We've been getting a lot of questions from medical providers, but also from friends and family about what is it that we actually do? What is pelvic floor physical therapy? And what do you need to prepare for coming into a visit? And what would a visit entail?
Yeah, these are great questions because a lot of times people will get a referral to pelvic floor PT and have absolutely no idea what that means. And they'll come to the first session and be like, I don't really know what this is. And they're coming in a little nervous and intimidated. They just answered a whole questionnaire about all these really intimate questions, like what their bowel and bladder function is and what their sex life is like. And so they can already come in a little intimidated. So we wanted to actually talk about what pelvic floor PT is and give listeners an idea of what to expect. Let's start with you, Sarah. What does an initial evaluation process look like? So somebody walks in the door, if you want to start there,
Okay.
or if you want to even back up a little further.
Yeah, so being in private practice, I'm getting a little bit more interaction with the patients before they even come into my clinic, which is fabulous. I've really been enjoying that because I can dismantle some of the maybe fear or anxiety or just hesitations with what it might all entail. So the conversation I always have is we're going to talk a lot about what's going on with your bowel, your bladder, sexual function, any pain that you might be having. But also, as physical therapists, we focus on the whole body. So sometimes we might not even be talking about just your pelvic floor, but your shoulder or your earlobe or your jaw or your big toe. Maybe not your earlobe, right? Maybe. You never know. So making sure that we're practicing holistic care to the best of our ability, I think is such an important part of this. So having that conversation with people before they even come in and then preparing them. So if you're comfortable with it, a lot of times we will do an internal exam. And people go, oh no, internal exam. And I go, typically it's only vaginally if you have a vagina that we are assessing. Men, often we will do rectal exams on, and a lot of times we'll do rectal exams on females as well. But it's just a matter of having the kind of conversation. A lot of times I won't do an internal exam on the first visit just because we're getting more of the history and understanding everything that's going on. But sometimes we do, right? Because people are like, no, that's why I'm here. I want to know what's up. I want your perspective. Allison, how does a pelvic floor internal exam differ from your OB-GYN?
An initial evaluation or pelvic floor internal exam is definitely different than an OB/GYN. Typically, we don't have the tables with the stirrups and the plastic sheets. We have nice regular bed sheets and making it a little bit more comfortable and no stirrups. We don't use speculums. Although I
The
will say
big
some,
metal thing.
yeah, huh?
Speculum's that metal thing that they put in you.
Right, the little duck bill that people talk about. Yeah, so it's typically a little more comfortable if comfort can be even said, but it's a little more comfortable than the duck bills. I know a lot of patients have that pain with the speculum. So using a finger, we use a gloved finger when we're washing our hands, putting on the gloves, using a lubricant, and just placing our finger at the vaginal entrance. And actually, before even doing the internal part, I guess I'm skipping ahead, but before even doing the internal part, we look at what's the skin quality, what's the external palpation, pressing on the outer labia, inner leg, glutes, taking a look at tenderness. Sarah is showing a pelvic model for those of you watching on YouTube so you can see what she's holding. So, what we do is we look at that external piece first. And oftentimes, if people have pain externally, that may be all that we do is just take a look at the external piece, have people do a contraction of the pelvic floor, which is also mostly known as a Kegel, and then also have people do a bearing down motion where they're feeling like you're passing gas, just to take a look at that tissue mobility. And if you do have any symptoms of prolapse, we may be able to see that. Do you have anything to add on what that looks like?
Yeah, we also look at the reflexes. We look at the muscles. We look at the skeletal system and alignment. We look at the nervous system and we're checking the sensory. So can you feel people have differences in sensation. Can they only feel that soft touch or only pinprick, temperature sensitivity, those kind of things? So we're looking at the dermatome, myotome stuff from an external standpoint. Then moving on from there, we always re-glove just because a lot of times we're checking, especially the reflex around the anus, and we do the internal portion. It's just a gloved, lubed finger. We're checking contraction, we're checking relaxation, we're checking bearing down at what we call the introitus or the opening. So it's just barely inside that vaginal canal. We document it as we're going around a clock. So is there any pain or sensitivity as we're moving in the direction around the clock to see, does the tissue feel any different? Was there some scar tissue? Is there any pain or sensitivity? Or can you even feel where we're actually palpating or touching? And then if everything feels okay at that standpoint, then we'll go a little bit further into the vaginal canal.
Once we're able to bring the finger in a little bit deeper with patient consent and making sure things are feeling comfortable, we do the same thing internally, taking a look at that pelvic clock, like what Sarah was saying, you going up towards the bladder, 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock, looking at all of the different muscle groups. So looking for any tenderness, looking for any tightness or any scar tissue that may be there. So just like other muscle groups in the rest of our body, we can hold trigger points or muscle tension in the pelvic floor, just like we do in other areas. So those are the things that we're looking at internally. We also have people do that pelvic floor contraction, again, that Kegel, and also have them relax and bear down and testing for what that tissue mobility is. If there's any prolapse, so the bladder prolapse, the rectum, lowering into the vaginal canal or the uterine.
So really, we're just trying to get a good scope of kind of everything that's going on. And I think the biggest thing to remember with any and all of this is communication is key, to the point where I have some patients who are like, it's okay. I'll just let you know if anything's up, because I'm like, all right, I'm fully communicating what we're going to do, trying to make sure that everyone is on the same page, that there's not anything unexpected going to happen. And of course, consent, right? That everyone feels okay with it. And if anything is too much or uncomfortable, we immediately stop, right?
Mm-hmm.
And then we can debrief about that. But that's typically, I think that's typically what an internal exam looks like.
Yeah. I often tell people it really doesn't need to be too long, too. It can be anywhere from 5 to 10 minutes, depending on how things are going, or maybe 1 minute if, again, it's all about that consent. So if somebody's having pain and just says, oh, I just need to get it done just so that you can find what you need, that actually gives us a lot of information. If you're having pain and feeling uncomfortable with it right from the get-go, that's a good sign and indicator that, hey, your pelvic floor doesn't want to be touched right now. And that's a sign right there. That's a treatment plan in itself, is getting the body, getting the mind, getting the pelvic floor okay with having some kind of external palpation or even just talking about it. So I think that's the big thing on the forefront, is we prepare people ahead of time on what to expect. It's really about the whole body experience, the holistic approach. We're not just treating the pelvic floor, we're treating the mind, the body, the spirit, all in one. And that's what makes pelvic floor PT really unique to different types of physical therapy. There's always a mental health component to physical fitness and physical well-being. However, in pelvic floor, there is even more that we hold because it's such a private and a space that we don't really talk about, or has a lot of potential stigma or ideas behind what that vaginal area is used for or what its purpose is in life. And so there's a lot of barriers that we might have to piece through before we even do an internal exam.
And for some patients, I don't even do an internal exam. We might see people for just a couple of visits, or we might see people for a couple of years. It just depends on what is going on and how we can better help people. But the idea is that we are just trying to meet you where you're at. And we understand that it can be a very vulnerable position. And so that's where the communication is the key.
Exactly.
Yeah. Yeah. I know. I'm trying to think. I also always check diaphragm and ASIS and pubic symphysis sensitivity.
I start with people clothed. I look at their
Yeah.
rainbow lumbar range of motion. How do they move? Squat mechanics, check out hip range of motion, even before I do an internal exam. And then usually on the second visit, depending on the conversation with people, we'll do an internal assessment. But yeah, exactly. Looking at the ASIS, and what the ASIS is, those bony hip protuberances on the front of our body. So looking at how the pelvis moves, for those of you who don't know that terminology.
Yeah, definitely just taking a look at all of that. Because it all can look good. Yeah. Hopefully that dismantles some of the fear, anxiety, frustrations with all of that. And if someone is not making you feel comfortable with any kind of exam or anything, don't do it. You never have to do it. Super, super, super important to be able to communicate that and just for you to feel as comfortable as possible.
Yep, listening to your body, what it's telling you. That's big. And it's hard when you're in a medical system that
Needs numbers.
if you don't feel comfortable with the person who is there in front of you and trying to help you with your healthcare, that's huge to listen to. So that's a great point, Sarah.
We got to advocate for ourselves.
Mm-hmm.
And if you need help advocating, we can help you advocate as well.
If you have any other questions about what a physical therapy assessment or treatment plan looks like, please reach out to us via email at info@thevmove.com, or you can reach out to us on Instagram at thev.movement. Until next time, keep the V's in your life moving. The information shared in this podcast by Sarah, Allison, and our guest interviews are intended for educational, entertainment, and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. While we are licensed physical therapists, we are not your personal physical therapists, and no patient-provider relationship is formed. If you have any health concerns or questions, please consult your medical provider. The information on this podcast or any of our other platforms is to use at your own risk.